was trying to care for my partner, he was infected, I am not. What would I do exactly to make sure I'm not infected, but, for example, say he's having difficulty breathing, and I can't just leave him alone?
Absolutely, you cannot,
No.
and you should not, right?
No.
So the moment a loved one, or if you develop symptoms that are concerning, things like, for example, shortness of breath, or for example, if you're coughing up phlegm that maybe is changing color, so like dark colored phlegm, these may be indications of severe disease. In particular here we're worried about pneumonia.
Yes.
And in this instance, especially, for example, people with underlying chronic medical conditions, they are more likely to develop these types of severe outcomes. And so in an instance like that, if you have a GP or a doctor that is associated with your family, perhaps a GP that you've been visiting for a long time, the ideal thing would be to call that doctor and get advice, okay? Because you don't want to leave symptoms to progress without intervening early, okay?
Yes.
So either discuss with your GP, or you would need to discuss with your local clinic if you don't have a doctor available, and then you'll get advice with regards to what you need to do. If it is an emergency situation, take the patient, or in your case, if you were to be sick, somebody would need to take you to the hospital. Alternatively, you may need to call an ambulance if the situation is deteriorating,
yes.
right?
Yeah.
But just make sure that when you are calling your GP, or when you are calling the hospital, or when you are going to the hospital, make sure that you call them beforehand to let them know of your symptoms so that they can prepare.
That makes a lot of sense.